Hi, I'm Dr. John Martin with Ivy Family Health Updates, and I'm here today with my sister, Dr. Catherine Martin, and my brother, Dr. Edward Martin, and our special guest today is Dr. Jackie Tudovan. Jackie is a full-time faculty at the University of Miami in the anesthesia department, where she specializes in both pediatrics and ophthalmology. And Jackie is going to talk to us right now about malignant hyperthermia, and it's an important topic in that here in Florida, just recently, a young girl died during a cosmetic surgery from malignant hyperthermia, and we wanted to know a little bit more about it. Who's susceptible to this? Can you treat it? And just sort of answer, people's questions about this.
Thank you, Dr. Martin. It's a pleasure to be here. A pleasure to be on your company. Malignant hyperthermia actually is a topic well known to the anesthesiology world, because back in the 60s, when a lot of development was going on with the volatile anesthetics that we use to put patients to sleep, some of them would have reactions where they would develop high temperatures during the surgeries or even after surgery was over, unexplained high temperatures.
Now the volatile, that means the
volatiles would be the gases that we used,
okay,
where they were inhaling these gases to keep them asleep. As the studies developed and we found out the reasons why certain patients were reacting like this to the general anesthetics, we found that it is actually a hypermetabolic reaction gone out of control in the body that is elicited or stimulated by these gases that are given to the patients. It is actually very rare. It's not as common, but because these deaths were unexplained, it became a big fanfare for the scientific world to find out what's going on. Nowadays, because of our increased vigilance using the technologies that we use and knowing how it's caused and why it's caused, it's very rarely found. If it is elicited through medical history that someone in the past had a certain reaction under general anesthesia, then we would commonly use other methods to place patients under general anesthesia, avoiding the gases that would promote this type of increased metabolic rate.
Do we know if I was going in, let's say, for general anesthesia with no family history, would I normally get gas? Is that sort of the first choice for a general anesthetic still?
Yes.
Okay.
After a thorough medical history, if there is no signs or evidence that in your family history you've ever had any type of doubt that there had been a reaction to the general anesthesia, we would normally give volatile anesthetics that nowadays are actually safer than what was used in the 60s, okay, where they were very toxic, at least a little more toxic. Now they're so non-soluble in our system that they go in and they go out in minutes. But they'll keep you under a general anesthesia state for the time that we need. And yes, and this is given with oxygen and all your other normal gases. Plus, we give you intravenous agents to help allay the pain or any other type of anxiety that the body may feel during general anesthesia.
And what happens if you have a reaction to the anesthetic? I mean, the hyperthermia, your temperature's going up, so.
Right.
And is it instant or is it after?
Actually, by the time the temperature has risen, it's a little bit late. So there are other signs that we use to pick up that the patient may be having a reaction to the anesthetic. Now, not all increases in heart rate or decreases in blood pressure, increases in blood pressure is going to mean that the patient is going to have this type of reaction, because it could be an allergic reaction to something else. So we rule out, but immediately when we see signs, we start turning off the gases and giving them something else to supplement the anesthetic, and then giving the treatment immediately will provide at least some sort of time until we get the patient to the next stage of care.
Given the potential treatment, you give them the treatment for malignant hyperthermia?
Immediately.
Okay.
If that's what we are
if you've been thinking
about it, then yes,
mm-hmm,
we immediately you give them. And every institution that provides general anesthesia, of course, has their safety card with the antidote for malignant hyperthermia available.
What is the antidote? I'm just curious.
It's a medicine called dantrolene,
mm-hmm,
and it's a white liquid or yellow white liquid. You have to prepare it, and it's given immediately to decrease the contractions of the muscles, because once you get into that high temperature, the muscles are really contracting and working on their own, tightening up. So you kind of
that's
loosens
right.
the muscles.
You get hard, right?
Yeah, the muscle
gets rigid.
Yes, it's like an out of control calcium release into the muscle tissues, And once the muscle starts breaking down, well, you have more complications. The key here is to actually pick up signs and symptoms before the temperature rises so that you can start giving the medicine.
And it's expensive because I know we don't do general anesthetics in my office, but if we did, we have to get $4,000 worth of dantrolene, and it only has a year's shelf life, but you have to have it in your office.
Mandatory,
yeah,
yes,
it's
correct.
mandatory for if you're going to be doing surgeries. Have you seen many? Have you ever seen a case of?
Not at all,
hyperthermia?
but I have come across patients who have had history where their great-grandmother or their grandfathers or their aunts and uncles have had some mysterious something happen to them during anesthesia. And so what we normally tend to do is just call it for what it may be, may not be, and we just give the general anesthesia without the gases, using some other agent so that we don't promote any type of reaction. Probably won't be the malignant hyperthermia, but we don't take the chances.
So pretty much anybody with a distant family history, if something didn't work right during anesthesia, they're out.
We sort of immediately just tag them a risk for a hypermetabolic reaction. And we don't want to call it MH because calling it MH, malignant hyperthermia, would mean that this patient has had a diagnosis made through testing their muscles and really getting genetic testing to call it that. So we kind of just brand it as a hypermetabolic reaction possible. And then they get switched over to a general anesthetic that would avoid any medicines or drugs that elicit that type of a reaction.
Which we have now.
We have plenty,
So it's,
we have
yeah.
plenty. We have plenty of hypnotics that we use. It's a balanced technique so that you also include narcotics and benzodiazepines, anti-inflammatories, or even steroids if we have to.
All right, so it's still when it happens, it's
Yes,
pretty
it's
bad, you know, or it can be. So.
It can be, but we have all the proper. If you have all the proper means and avenues where you can take the patient to the next level of care, then I think the most important thing is recognizing the risk before it happens.
Prevention.
And preventing it. Yes.
Well, that's great.
Thank you.
Thank you.
Welcome.
Thank you.